Dear audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 8th lecture on hematology. Today, day 3 of lecture on leukemia. Today's topic is subleukemic acute leukemia and emergency in acute leukemia. So topic is subleukemic acute leukemia and emergency in acute leukemia. First come to subleukemic acute leukemia. Now come to what is subleukemic acute leukemia. Dear audience, you know leukemia is neoplastic proliferation of hematopoietic stem cell with appearance of immature form in peripheral blood with or without infiltration in other organ or tissue is called leukemia. So, you know in acute leukemia the predominating immature cell is blast cell. In case of acute lymphoblastic leukemia, the blast cells are lymphoblast, and in case of acute myeloblastic leukemia, the blast cells are myeloblast. Now come to what is subleukemic acute leukemia. It is an acute leukemia definitely, and in front of it there is subleukemic. What is the definition? Acute leukemia with normal total leukocyte count or acute leukemia with leukopenia is called subleukemic acute leukemia. So acute leukemia with normal leukocyte count or acute leukemia with leukopenia is called subleukemic acute leukemia. So definitely it is acute leukemia. It is an acute leukemia. We know in leukemia there is leukocytosis. In leukemia we know there is leukocytosis, but it is such type of acute leukemia where there is no leukocytosis, but there is immature cell blast cell in the peripheral blood and also in the bone marrow. It is more than 15%. So in subleukemic acute leukemia, what happens? Total leukocyte count is 4,000 to 11,000 per cubic millimeter of blood, or total leukocyte count is less than 4,000 per cubic millimeter of blood. So in all leukemia we get leukocytosis, but in case of subleukemic acute leukemia, it is an acute leukemia, but the total count is either normal or below normal. So it is called subleukemic acute leukemia. Types of subleukemic acute leukemia: it may be myeloblastic subleukemic acute leukemia, and it may be lymphoblastic subleukemic acute leukemia. So it is two types: myeloblastic subleukemic acute leukemia and lymphoblastic subleukemic acute leukemia. Whatever be the type of subleukemic acute leukemia, what be the presentations? The presentations of subleukemic leukemia like acute leukemia. So present clinical presentation. Clinical presentation like acute leukemia. Dear audience, I have told you what are the clinical presentations of acute myeloblastic leukemia and clinical presentation of acute lymphoblastic leukemia in my day 2 lecture on leukemia. Now come to how to diagnose subleukemic acute leukemia in laboratory. Laboratory diagnosis of subleukemic acute leukemia. We have to do first blood examination. We have to do blood examination, then bone marrow examination, bone marrow examinations, and also we have to do peroxidase test. We have to do chromosomal study, we have to do flow cytometry, First come to blood examination. We'll get, first we have to do hemoglobin estimation. It will be reduced. As the patient becomes anemic in leukemia, it will be reduced. ESR, it is elevated. Then total leukocyte count. The audience, I have told you in all leukemia there is leukocytosis, but in case of subleukemic acute leukemia, total leukocyte count is normal or it is decreased, that is leukopenia. So the total count will be see either within 4,000 to 11,000 per cubic millimeter of blood, or the total leukocyte count is less than 4,000 per cubic millimeter of blood, that is leukopenia. So this is important for subleukemic acute leukemia. Then we have to do DLC, differential leukocyte count. Although the count is below normal or within normal, the WBC that we get in differential count, the most of the cells are blast cells. Most of the cells are blast. If it is a case of myeloblastic subleukemic acute leukemia, the blast cells are myeloblast. So if it is myeloblastic subleukemic acute leukemia, so if it is a case of myeloblastic subleukemic acute leukemia, the most of the blast cell that we get in DLC, the blast cells are myeloblast. So in case of myeloblastic subleukemic acute leukemia, the blast cells are myeloblast. If it is a case of lymphoblastic subleukemic leukemia, if it is lymphoblastic lymphoblastic subleukemic, acute leukemia. If it is lymphoblastic subleukemic acute leukemia, then the blast cells are lymphoblast. So in case of myeloblastic subleukemic acute leukemia, we will get most of the cells are myeloblast. In case of lymphoblastic subleukemic acute leukemia, we get most of the blast cells are lymphoblast. Then we have to do peripheral blood film. Peripheral blood film. RBC series cells show anisocytosis with a few number nucleated red cells. Dear audience, why there is nucleated red cells or normoblast in peripheral blood in acute leukemia, I have discussed in day 2 lecture on leukemia. I have discussed it in day 2 lecture on leukemia. WBC series. Dear audience, I have told you in all leukemia, in WBC series we get leukocytosis. Here we will get normal count or leukopenia. Cells show normal total count or show leukopenia. And most of the cells are blast. So whatever be the type, if it is myeloblastic subleukemic acute leukemia or it is lymphoblastic subleukemic acute leukemia, whatever be the type, in both types we will get normal total count, or in both types we can get leukopenia, and in both cases we get the blast cell. If the blast cells are myeloblast, it is myeloblastic subleukemic acute leukemia. If the blast cells are lymphoblast, it is lymphoblastic subleukemic acute leukemia. So in peripheral blood with normal total count or with leukopenia, the blast cells are myeloblast. In myeloblastic subleukemic acute leukemia. So if it is a case of myeloblastic subleukemic acute leukemia, WBC series cells show normal total count or leukopenia with most of the cells are myeloblast. But if it is a case of lymphoblastic subleukemic acute leukemia, what will be the findings? If it is a case of lymphoblastic subleukemic acute leukemia, we will get lymphoblast in lymphoblastic subleukemic acute leukemia. So dear audience, if it is a case of lymphoblastic subleukemic acute leukemia, we will get normal total count or leukopenia with most of the cells are lymphoblast. Then platelet in both cases, either myeloblastic or lymphoblastic subleukemic acute leukemia, seen reduced. This is the peripheral blood film findings of subleukemic acute leukemia. Then we have to do reticulocyte count. Dear audience, you know it is normal 0 to 2%. In acute leukemia, whatever the type, it is increased, it is elevated, increased. Why it is increased? I have told you in day 2 lecture on leukemia. Then come to bone marrow examination. Bone marrow examination. Bone marrow in case of myeloblastic subleukemic acute leukemia. So bone marrow of myeloblastic subleukemic acute leukemia like the bone marrow of acute myeloblastic leukemia. Dear audience, I have told you in day 2 lecture on leukemia what is the bone marrow findings of acute myeloblastic leukemia. The bone marrow findings of acute myeloblastic leukemia is the findings of myeloblastic subleukemic acute leukemia. Then lymphoblastic subleukemic acute leukemia. Dear audience, again I want to say in day 2 lecture on leukemia, I have told you about the bone marrow findings of acute lymphoblastic leukemia. The bone marrow findings of acute lymphoblastic leukemia that I have told you in day 2 lecture on leukemia is the findings of lymphoblastic subleukemic acute leukemia. Then we have to do myeloperoxidase test, whether it is subleukemic acute leukemia, myeloblastic or lymphoblastic, to differentiate it. Then we have to do flow cytometry to diagnose the case of leukemia. Then you can do chromosomal study to know whether it is myeloblastic or lymphoblastic. And this flow cytometry, this chromosomal study, myeloperoxidase, etc. I have told you in the day 2 lecture on leukemia. Again, myeloperoxidase test, chromosomal study, flow cytometry, I have narrated briefly in my day 2 lecture on leukemia. So this is all about the subleukemic acute leukemia. Now come to emergency in acute leukemia. Dear audience, we know usually there is leukocytosis in acute leukemia. The count is more than 11,000 per cubic millimeter blood, and it may be more than 1 lakh per cubic millimeter of blood also. So what are the emergencies arises in acute leukemia? It may be septicemia, it may be neutropenic fever, it may be disseminated intravascular coagulation, that is DIC. It may be leukemostasis, it may be leukemia cutis, First come to septicemia as an emergency in acute leukemia. First come to septicemia is an emergency in acute leukemia. Dear audience, we know what is septicemia. Presence of blood, presence of bacteria and blood is called bacteremia. So presence of bacteria in blood is called bacteremia. If the bacteria multiplies in the blood, it is called septicemia. So bacteria multiplying in blood is now known as septicemia. So how septicemia occurs in acute leukemia? You know, septicemia is an emergency, because septicemia may be associated with life-threatening condition. So it is an emergency. How septicemia occurs in acute leukemia? Dear audience, you know, in acute leukemia, what happens? There is leukocytosis. There is leukocytosis, and most of the cells are blast, that is immature. So in case of acute leukemia, there is leukocytosis, but most of the cells are blast, that is immature. An immature cell cannot provide protection. This immature cell cannot provide protection. As this immature cell cannot provide protection, so there is chance of infection. And as there is chance of infection, there is chance of septicemia. Again, as increased number of WBC in the blood, leukocytosis, but most of the cells are immature, most of the blast cell. So blast cells or immature cells cannot provide protection. So there is chance of infection, and this infection will lead to septicemia. Now come to neutropenic fever. Neutropenic fever. Dear audience, in acute leukemia, you know, most of the cells are immature, that is blast. As most of the cells are blast, so there is decreased number of segmented or mature neutrophil. So there is neutropenia. As most of the cells are immature blast cells, so there is very decreased number of neutrophil in the blood. So in case of acute leukemia, there is neutropenia. As there is neutropenia, there is less protection in the body. So there is chance of infection. And there is chance of infection. If anybody suffers from infection, you know, there are some cardinal signs. One of the cardinal signs of inflammation or infection is fever. So patient will suffer from fever. As this fever is due to neutropenia, so this is called neutropenic fever as an emergency in acute leukemia. Now come to disseminated intravascular coagulation, that is DIC. Now come to DIC. How DIC occurs in acute leukemia? How it occurs? How it occurs in acute leukemia? Dear audience, you know, in acute leukemia, what happens? There is leukocytosis. In acute leukemia, there is leukocytosis. And in acute leukemia, there is also immature cells, that is blast cells. You know. So this leukocytosis is associated with increased viscosity of blood. It is associated with increased viscosity of blood. As there is increased viscosity of blood, there will be sluggish flow of blood. Sluggish flow of blood. So if this is the blood vessel and endothelial lining like this is the blood flows like this. So blood is flowing. If increased viscosity of blood, the blood flow will be sluggish due to increased viscosity. Why increased viscosity? Increased viscosity is due to increased number of WBC in blood. So there is increased viscosity and sluggish flow of blood. Number two, immature cells or blast cells in acute leukemia, it secretes procoagulant. It secretes procoagulant. As the immature cells or blast cells or cancer cells secretes procoagulant, as cancer cell, that is leukemic cell secretes procoagulant. As it secretes procoagulant, there is hypercoagulability of blood. So there is hypercoagulability of blood. Again, as the cancer cell, there is a leukemic cell or blast cell secretes procoagulant, so the coagulability of blood is raised. So this is called hypercoagulability of blood. Dear audience, you know, for thrombosis we know, for thrombosis there is Vircostroid. And it includes, one is hypercoagulability of blood, it includes endothelial injury, and it includes alteration in blood flow. Dear audience, we know if this is a blood vessel, blood running like this, the endothelium. If endothelial injury or if there is sluggish blood flow or alteration in blood flow, so alteration in blood flow here due to sluggish blood flow of blood. This sluggish flow of blood is nothing but alteration in blood flow. So this sluggish flow of blood in acute leukemia due to leukocytosis is nothing but alteration in blood flow. Again, hypercoagulability due to secretion of procoagulant, there is hypercoagulability of blood. So among the Vircostroid, here two is present. One is hypercoagulability of blood due to secretion of procoagulant by the cancer cell or leukemic cell. Another is alteration in blood flow. It is nothing but the sluggish flow of blood due to leukocytosis. So as there is hypercoagulability of blood, as there is alteration in blood flow, these two is associated with if this blood vessel, these two hypercoagulated blood and alteration blood flow is associated with formation of multiple thrombi throughout the body. formation of multiple thrombi throughout the body, and formation of these multiple thrombi throughout the body is nothing but disseminated intravascular coagulation. So, how it occurs? DIC in acute leukemia is due to number 1, hypercoagulability of blood. Hypercoagulability of blood. Number 2, due to alteration in blood flow. Alteration in blood flow. So, hypercoagulability is due to secretion of procoagulant, and alteration in blood flow, that is sluggish blood flow, is due to leukocytosis in acute leukemia, and it is associated with disseminated intravascular coagulation. Dear audience, if anybody suffers from disseminated intravascular coagulation, there is consumption of platelet and there is consumption of coagulating factor. You know, as there is disseminated coagulation throughout the body, there is consumption of clotting factors and consumption of platelet. So, patient may come to you with bleeding manifestations. So, patient may come to you with hemorrhagic disorder, and hemorrhagic disorder is nothing but an emergency in acute leukemia. Now come to leukemostasis. Leukemostasis is nothing but stasis. So, now come to leukemostasis. Dear audience, you know, in acute leukemia, what happens? There is due to increased WBC count, there is hyperviscosity of blood. So, hyperviscosity of blood. Hyperviscosity of blood, and due to hyperviscosity of blood, there is sluggish flow of blood, and this sluggish flow of blood is nothing but leukemostasis in leukemia. So, as this sluggish flow of blood occurs in leukemia, it is called leukemostasis. As sluggish flow of blood in leukemia due to leukocytosis, this sluggish flow of blood in leukemia is called leukemostasis. So, sluggish flow of blood through the vessel may lead to ischemia. It may lead to ischemia. It may lead to ischemia in tissue, and sometimes in acute leukemia, may patient come to you with ischemic heart disease, that is, patient may come to you with myocardial infarction, and ischemic heart disease is nothing but an emergency in acute leukemia. So, sometimes in acute leukemia, patient may suffer from ischemic heart disease. Ischemic heart disease. So, sometimes in acute leukemia, patient may suffer from ischemic heart disease, and it is due to sluggish flow of blood, and it causes ischemia in heart. This is all about the leukemostasis. Now come to Leukemia Cutis. Leukemia Cutis. You know, in acute leukemia, there is thrombocytopenia. In acute leukemia, there is thrombocytopenia. And due to thrombocytopenia, you know, there is hemorrhagic manifestations, either gum bleeding, nasal bleeding, for rectal bleeding, sometimes there is purpuric spot. And this thrombocytopenia sometimes may lead to large cutaneous hemorrhage. So this thrombocytopenia in acute leukemia sometimes may lead to large cutaneous hemorrhage, and this large cutaneous hemorrhage is known as leukemia cutis, called leukemia cutis. Dear audience, this is all about the emergency in acute leukemia, septicemia, neutropenic fever, DIC, leukemostasis, leukemia cutis, and this is all about subleukemic acute leukemia and emergency in acute leukemia. Today up to this, thanks all.